Hello, you're listening to WNHH 103.5 FM, La Voz Hispana Radio, downtown New Haven, and streaming live via Facebook and YouTube. This is Norma Rodriguez Reyes, your host in Que Pasa. Today we have live in our studio audience Bernard Macklin. Bernard is the community coordinator for CARE. He's outgoing, loud, and really cares about the community. Yes. That's why he does what you soon will be learning about. We also have Jacqueline Salgado, and she's currently an MBA graduate student with a concentration in healthcare administration, expected to graduate in December 2023. She started working at the Cornell Scott-Hill Health Center as a COVID-19 navigator, and now she works for CARE, Community Alliance for Research and Engagement. Jacqueline's positions consist of making sure that the community around her receives the proper updated information when it comes to health equity and vaccine education, and to ensure a safer community by going out and having conversations with various residents from various neighborhoods in the city of New Haven. And she wants an opportunity to be as healthy as possible. That's what she wants. And Bernard also, that is their goal. An opportunity for the individual to be as healthy as possible. Well, tell me, Bernard, tell me about CARE.
CARE came about around 2006. It started at Yale, the Department of Public Health. Somewhere around 2016, it moved over to Southern Connecticut State in the College of Health and Human Services. We have multiple programs that come out of CARE, but this is just adult vaccinations, which the one that we represent is just one of the many that CARE actually provides to the city of New Haven and beyond.
Wow, that's wonderful. So what is happening in the community and the importance of the CARE team?
The biggest thing is that we want people to become trusted messengers, actually step up and step in and begin to take back and be concerned about their own mental health, their own medical health, all areas of medical equity that we tend to just throw to the side due to multiple reasons. And though we want people to actually come back in and take control of their communities.
So how do we go about removing health disparities?
The biggest thing that I see in my time here with CARE over the last 3 years is this big word that most of us know very well, which is trust. A lot of times, because of so many, when you deal with racial equity, so many things and disparities that happen in our community, dealing with the social determinants of health that happen all around here in New Haven, a lot of people just don't trust. And so we want to come in as CARE and build those trusted messengers in the community residents so they can begin to take concern about what happens in their community dealing with their health.
So tell us what's happening in Connecticut in terms of COVID-19.
You know what? A lot of people, and I have to laugh, a lot of people are just sick and tired of hearing it. But we want people to know that COVID hasn't gone anywhere. COVID is very much still in our communities. People are still getting severely sick. Hospitals are still being filled up with people that are seriously sick or medically ill behind COVID. And we just still out here fighting the good fight. And just to let people know that we're still out here, letting people know what they need to know about COVID. It hasn't gone anywhere, people. It hasn't gone anywhere. And that's kind of what we're representing by providing so much information, providing clinics with our partners over at Cornell Scott-Hill Health Center, who is our vaccinator. Without them, we wouldn't be here. So we're very proud of that relationship. So together, we go out to different organizations, different events around the city, letting people know we're still here. We care about you, and we care about what happens to you. And your health is so important to us. We don't want you to put that to the side.
So, tell me, Jacqueline, why are we seeing a spike in COVID?
Well, right now the CDC is no longer taking any COVID cases, any numbers from the COVID cases that we have been seeing. So the new way that they have been doing it is they do it through the waste waste sludge waters, and this is located in. I'm sorry, give me 1 second. This is located in East Haven. They do take different samples from it, and they try to see what are the different variants that are coming out from it, and what are the numbers from that. They have been seeing that in months of people going back to school, in September, and especially winter seasons, they have been getting a lot more higher, and that's where the peak comes.
Okay. So, what are the recommendations when we see this high peak? What is recommended?
I'll say a lot of times stay very connected to your physicians, stay very connected to the CDC website, stay very connected to the New Haven Health Department, stay very connected to the Fairhaven Health Centers, all of these centers and medical centers around the area that's providing information that is so important just to keep you abroad on actually what it is and how it's affecting your communities.
Wow. So how can someone stay safe and healthy while the COVID flu are increasing?
The way in which people can do it is whenever they come back from a store or anywhere, they can wash their hands when they get home. They can keep wearing their masks. If keeping a 6-foot distance is what people need to do, then maybe keeping that 6 distance. And just making sure that they're up to date with all the information that is going on about COVID. And, of course, getting vaccinated.
And wearing your mask when you're in large crowds, people. That's one of the biggest things. Typically, when people go on vacation, they don't wear their masks and they come back sick. So wherever you go and there's a lot of large crowds, it's still very important for you to wear your mask.
So we're still not, right
we're
when
not,
we're thinking,
we're not there
we're almost out of it.
Yeah, we're almost out of it.
Gotta
yes.
continue doing this, huh?
That's correct.
So tell us about the importance of an individual's wellness, preventive care, and adult vaccines. What is considered wellness?
When I think about wellness, that's completely taking care of every area of your life, dealing with your medical history and actually what's going on with you, to make sure that you're staying in contact with your physician when it comes to nutrition, when it comes to your medical history. We're going as far as COVID is concerned, as far as the flu is concerned, any area where you should receive some form of vaccination. But staying on top of the knowledge, staying on top of the materials is so important, so you know exactly what's going on at this particular time. Watching the news, I believe when we were younger, we never liked to watch the news, but I see it's so important to stay in contact with your local news, just to know what's actually happening around you, point by point.
So what is FQHC?
Federally Qualified Health Centers. You have 2 of them, I believe, 2 large ones here. One is the Cornell Scott-Hill Health Center, and the other was the Fairhaven Health Center.
Yeah, and the Fairhaven Clinic is pretty soon going to be building an extension, right?
Correct.
But the Cornell Scott-Hill Health Center has definitely been expanding. I mean, not too long ago, we went to the Q House,
yes,
where the big celebration over there. So the clinics, the Fairhaven Clinic is definitely growing a lot. They have in all kinds of different neighborhoods, they have, locations where people can go.
I think it's important to recognize where your federally qualified centers are between Cornell Scott and Fairhaven, just so you're making that connection with the providers that are actually have firsthand information as it relates to adult vaccinations or any level of vaccinations, any pediatricians that actually work with children. I think it's just so important to make those connections.
So, what makes them different?
The name. What I really would say is a lot of difference. One thing about Cornell Scott, when it comes to innovation, they have actually expanded their services, to areas that I wouldn't think a health center would actually do. But I'm so proud of Mr. Michael Taylor and actually his leadership and actually what he's provided. He had allowed me to actually come to Connecticut from the state of Michigan to actually work for Cornell Scott-Hill Health Center for several years. So I got a chance to know him personally and his mindset when it comes to helping people. And I think I don't want to throw throw Fairhaven under the bus because they're doing exactly the same things over in the Fairhaven community with a lot of the Hispanic families that are living in that Fairhaven community that should make that connection to them.
Yes. And just recently, they in Long Wharf, both of them kind of merged. There was
yes,
like
different services out at the Long Wharf facility.
And yeah, for Fairhaven Health Clinic and also for Cornell Scott-Hill Health Center. They have a facility there at the Long Wharf that provides.
Correct.
So what are some of the places that people can go to get vaccinated?
Some of the places, just as mentioned before, Fairhaven Clinic, Cornell Scott-Hill Health Center. We do know that Cornell Scott-Hill Health Center does have different locations, one out of Dixwell, also one out of West Haven, Ansonia. And then we also have local pharmacies, CVS, Rite Aid, Walgreens. And you can also visit vaccines.gov, and that can give you a more insight of where you can get vaccinated as well.
Okay, and then what about for the individuals that do not have insurance or that are not undocumented? Because let me tell you something, that is like the most ridiculous nomenclature that I can hear for these folks, because they have more documents than us that live here in America. So that is definitely not enough. But without legal status in the United States, I don't know, whatever it is. But for our immigrant population, what is recommended for them if they do not have insurance?
There is a program. It's called the Bridge Access Program. You can find where you can get vaccinated throughout that program on vaccines.gov. But that is for individuals who are not insured, or they are insured and their insurance is just not covering all of the COVID-19 costs.
And at Cornell Scott, I could tell you they have a pay scale, actually, where they look at your income, if you have income, and provide a service based on that income. So they don't want to turn anyone away. And I'm more for sure Fairhaven has the same over at Fairhaven.
Okay, and CARE is, we envision thriving communities that foster health and well-being for all people in all systems, right?
That's correct.
And I think that's wonderful that you guys are doing this, especially between, Yale. It was first Yale that started it, and then it went to Southern, and now it's in our communities.
Well, we're still very, very much still connected to Yale School of Public Health. The grant that we were under worked between both not Cornell Scott, but between CARE and Yale, the Department of Public Health.
And what does CARE stand for?
Community Alliance for Research and Engagement.
Okay. Well, is there anything else that we need to mention before we close?
You know what, people? Thank you for allowing me to come on today. I just want to reach out to you and just say this. We care enough about you to come out in this hot sweater just to let you know how much we love you. We want you to be healthy out there. We don't mean to bother you. We don't mean to make you angry. We're just people in the community that have enough sense to tell you when something is wrong, and we want to make it right.
Thank you.
Get vaccinated.
Okay, Jacqueline?
Yeah, just make sure that you're staying healthy during these times. We do know that the winter's coming up and holidays as well. So just making sure that you're taking all those preventative measures and staying safe.
Thank you. And we'd like to thank the the Cornell Scott-Hill Health Center, a community of caring, for actually caring about our communities out there. Thank you so much. You've been listening to WNHH 103.5 FM LP, La Voz Hispana Radio, and this is Norma Rodriguez Reyes, your host in Que Pasa, health, money, and love, and plenty of time to enjoy it, and may we live to be 120 in good health. Until next time. In good health.
Yes. Blessings.
Thank you.